Hi everyone, I'm Teonna Woolford. I am 30 years old. I have sickle cell SS, and I am the co-founder and CEO of the Sickle Cell Reproductive Health Education Directive, also known as SC-RED.
That's such a great title. I love like the abbreviation and of course everything that stands for. Could you tell me more about how you got started with it or where the idea came from? I know you had some personal struggles.
Yeah, absolutely. So basically, 11 years ago, I was 19. Um, and I was participating in clinical research to have a haplo bone marrow transplant, so a half match. My mother was my donor. And like everyone has heard me say a million times, I made the decision out of desperation, and I was pretty much willing to give up anything to be cured and to risk anything except my fertility because I've always wanted a lot of children. And, when I expressed that to the doctor during my consultation, he's like, oh, well, I don't know why you'd be worried about the transplant making you infertile because you're probably already infertile due to sickle cell. And I remember being devastated, but still going home and doing this Google search because I was looking for like education about egg freezing. And when I saw that it could be over $10,000, I started looking for resources that would help cover the cost of that. And everything I saw was like these private foundations who give away grants for egg freezing if you had a diagnosis of cancer. So, long story short, I went through with the transplant thinking that it was a fair trade off if I was cured from sickle cell, that I lost my fertility. Um, and in hindsight, it was not a fair trade off. You shouldn't have to pick and choose. You should be able to do both. You should be able to pursue a curative therapy and still preserve the right to have biological children. And, also in hindsight, I ended up rejecting the transplant. So I still have sickle cell, but now I'm also infertile. And so basically, I just had this idea that I'd start a foundation and give away grants for anybody with sickle cell because it's not just curative therapies that put you at risk for infertility. It's disease progression. It's other things that we don't think about. So, yeah, I thought I'd just give away grants. But then talking to my then hematologist, Dr. Lydia Pecker, who studies fertility and sickle cell, she really pointed out to me that this was like a social and reproductive justice issue that would require advocacy. And then I sat under my longtime mentor, Dr. Kim Smith Whitley, when she did a presentation on reproductive health, and it touched on everything from puberty to hormones to sex, just everything. And then I realized that when you talk about sickle cell and reproductive health, it's about not just fertility. It's this huge umbrella and this huge unmet need. And I started really paying attention to some of the comments in the social media groups. And I was seeing people talking about how they're too embarrassed to talk about pain with sex or pain with their cycles, things like that, or worried about priapism and the depression that comes along with that and the embarrassment. And I just realized how stigmatized it was and that this was a huge unmet need in like an untapped area. And, it's exciting because I think that for so long, we as a community have had to prioritize first survival and then basic education and awareness. But now that we are living longer and really because of the resiliency of the community, we've been able to thrive. And so I think we have this new opportunity to kind of revision how we see ourselves and how the world sees us. And so the message, while my mission is about reproductive health, there's this broader message that like individuals with sickle cell disease are whole people. And in order to honor that wholeness, you have to prioritize reproductive health. Sounds
Wow.
like a long
Yeah.
answer.
No, that was so perfect. I literally could not agree more with everything that you were saying. And I'm so sorry you experienced that. I can't believe a doctor said that to you, and that's like a whole nother problem, right?
Yeah.
Sickle cell warriors are treated. And then um, it's so amazing that you took something, I would say, traumatic and you've turned it into this organization that's helping so many people. So can like anyone apply for these grants or how does that work?
Well, we haven't gotten the funding yet, but it's like a little sneak peek. I think it's on the way, and yes, anybody. You could, whether you're pursuing a curative therapy, whether you're in hydroxyurea, just anybody with sickle cell will be able to apply. So,
That is so awesome. As a medical student, they're constantly telling us, like, just from being in medicine, most people aren't gonna like have a normal adult life until they're in their 30s. So they're always
yeah,
telling like women to freeze their eggs, which is a whole nother like,
yeah,
sexist issue. But yeah, like none of
right.
us can afford it. We're broke. So it's amazing that, you've thought about that and you, of course, unfortunately, after going through that. And then in terms of more of the like education, advocacy, and justice part, do you do that stuff in line with like men's sexual health too,
Yeah,
or
and I really have to credit, actually, I have to credit Cassandra Trimnell and then the men in the sickle cell community because myself and my two co-founders, they have really been heavily involved in women's health. And there's a very real possibility that this organization would have just been women's reproductive health. But it was conversations with Cassandra, Marzadi, Dr. Marzadi, and then paying attention to what the men in the Facebook groups were saying and just what they go through as far as priapism and how painful that is and the mental toll and the pressure that they feel to still perform and please their partner while they are having these experiences and the shame and embarrassment. So yeah, this is an organization that touches everyone. Like whether you want children, don't want children, gay, straight, bisexual, transgender, like literally anyone. And when I say reproductive health touches everyone, I mean that, like, definitely in the sickle cell community, but beyond. Like, we have cancer organizations, diabetes organizations, other rare diseases coming to us and saying like, wow, we want to get involved because we've never really prioritized our reproductive health either. So there's really like a place for anyone in this organization.
I really love that because I agree with what you're saying, and I think sickle cell especially has a special place in kind of some of the reproductive justice concerns, like
Yeah,
what you were saying already, and pointing out like specific things that sickle cell might make more difficult for you. But something as simple as dating and sharing that information with your partner and getting that kind of support. Yeah, because I'm a big believer that sexual health is part of overall health and well-being, so it's
exactly.
amazing. And then this is kind of, I mean, about Women's History Month, I guess, but you've listed so many amazing mentors, I'm guessing, that have all come together to put this together. So if you could talk a little bit about like what working with them has done for you and what you hope to maybe do for other people moving forward.
Yeah, I love that question because I really do consider myself and my organization to be the product of God's grace and mentorship. I just my two co-founders, they are these giants in the hematology, the medical field, and for them to literally stop what they're doing to make sure that not only the organization is okay, but that I'm okay, and to really take time to educate me. I mean, there's been times that we'll have these huge meetings with like HHS or CMS, and they will literally just take 3 hours on their weekend to make sure that I'm comfortable and feel well prepared. And when I like reflect, because I think people on the outside they assume that SC Red has been up and running for 5 years, and I'm like, no, we just got our 501(c)(3) status last April. And I remember like when I first started, because I never thought that I would start an organization. And literally, I've had people ask me, like, well, when are you going to start something? When are you going to start something? And I was like, no. So when I first started, I was like very insecure and I was terrified. And they were telling me, they were like, Teonna, this is huge. This is going to blow up and we're here to support you. But I really underestimated how big this was going to be. And I remember like constantly second guessing myself. And they would always tell me, like, no, like, you've got this, you're doing great, and just really encouraging me and pouring into me. So, not only teaching me the medical implications, but just the support that they give to me personally has been amazing. And there's a lot of really strong women on my board and on my different committees. And so, I'm very fortunate.
That's so awesome. I think just from my like outsider perspective, that SC Red and you are a very big deal. I definitely was one of the people that thought that this has been a thing for forever, and I just didn't know about it. So that's amazing. And you mentioned like having like two big names in the hematology world, but to me, you're a big name now. So I feel like I can't really think about sickle cell without thinking about you. Same with like reproductive health. So that's
That's
amazing.
so
I
sweet.
aspire to be like you and be involved more in the way that you are.